All right, so let's go ahead and start, with the first comment or question that I have in here. This one is, anecdotally, I can tell you that I definitely noticed both positive and negative effects of TMS in the second and third session. They were very subtle, but amplified as time went on, which is how I was able to attribute such small initial changes to TMS. But as a clinician, it is hard to tell whether a patient is just experiencing placebo. I think this was an answer to one of the questions that I was talking about, the dip, and then there's a placebo effect that could happen in the first a few sessions. That could be the theory of why a dip happens and what have you. And then this person is kind of commenting on the fact that there is some kind of change that actually happens in the first couple of sessions. So hopefully I wasn't misunderstood. I did not say that there would not be any change in the first couple of sessions, but it's not the effect that we actually want out of TMS. What we want from TMS is neuroplasticity. Of course, it's going to cause something in the first couple of sessions, but that's not enough change for somebody to be able to notice a lift in their depression. I always use the example of somebody training to build up muscles. Of course, you're going to have a pump in your muscles, after a workout for a couple of hours, but that doesn't mean that you grow muscles already. After you go, sleep the next day, if you measure your muscle size, it's going to be exactly the same, right? Barely any noticeable change by one day. But if you keep at it and you continue training and working out over time, you're going to see some new myocytes forming and some of the myosin in your muscles kind of growing over time. Similar idea, but for your brain. Yes, you're going to have some effect from the first couple of sessions. Otherwise, we would have started with number 3 rather than number 1 and 2. It's a joke, logically, it doesn't happen. But what I'm trying to say is that, yes, we start, in the beginning, you might have some of the pain that will happen with the TMS. You might have some measured changes, in your mood and what have you, but that's not what we're aiming for. And keeping those in check would help prevent a placebo-like dip symptoms from happening. So that's why I always tell my patients, that it's a long journey. We have to kind of not make any changes, for at least the first couple of weeks. In that phase between 2 weeks to 4 weeks is when, if we need to make a change, we can make a change. And if by the 4th week you're not seeing a response, and then you're going to say, hey, maybe TMS is not working for me, then that would be acceptable by then. Okay, well, hopefully this comment helps. Disclaimer. Although I am a psychiatrist, this is not a professional advice, as I am not familiar with the specifics of your unique situation. Please contact a psychiatrist in your area with more questions. This disclaimer is added to my answers on social media after consulting with the American Psychiatric Association. Thank you.